Well, good morning, everyone. Thank you for joining me for the Value-Based Care Using SAS Health Cost of Care Analytic Accelerator. I'd like to first start by introducing myself. My name is Lena Clover. I'm a Research and Development Director at the SAS Health and Life Sciences R&D team. I have 15 years of healthcare software development experience. I currently manage the SAS Health development team. And in addition, prior to healthcare, I have extensive experience in BI, the SAS platform, and VIA platforms. So I believe many of you in the audience are already familiar with the value-based healthcare initiatives. But let me pause and ask a few questions. What is value-based care? How do you measure it, and why is it so hard? Well, in simple terms, value-based care is a delivery model focused on outcomes. The value of care is measured by a simple formula. It's your outcomes divided by the cost of services to achieve that outcome within a certain period of predefined time. Simple enough, right? So why is it hard? Why is it hard to measure? Well, in reality, realizing high value care is one of the hardest aspects of value-based care, because it means you have to deliver better outcome at a lower cost. And it also means that you have to look at many aspects of your cost and your outcome, not just simply doing cost calculation. The first aspect is the total cost of the medical services per condition. The second aspect is your outcome. You have to identify the cost of the negative outcome associated for that same condition. The third aspect is you have to evaluate those outcomes and the cost not only at the population level for the cohort of patients with the same condition. You need to evaluate it at the individual patient level so you could see the outcome on an individual patient-centric way. The last thing is the cost. Of course, the bundled payment is one approach to reduce healthcare costs. A good example of bundled payment is the pregnancy episode, where the bundle for a pregnant woman to deliver a baby, all the services associated with the prenatal care, the ultrasound, the delivery, the facility fee, and postpartum care is paid as one single payment instead of individual payments for each of the services. So, who needs value-based care? In my opinion, all health organizations need it. It's an obvious need for healthcare payer organization like the government, the Medicaid, the Medicare states who have to manage the cost for their population, as well as private insurers. We are starting to see provider organization and affordable care organization starting to evaluate value-based care with their own data, with the idea of giving them better leverage for them to negotiate contracts with payer organizations. The other trend we're seeing is for large employers and pharmaceutical companies going into value-based care pricing. I'd like to emphasize that this is not only a US-centric only initiative. This is a worldwide need, even in countries where they have a single payer system. For example, in Sweden, they're adopting the Porter VPC model in the Stockholm area. What that model does, it assigns a team of providers to work together to coordinate the care for each patient. Another example is in the Netherlands. They are starting to integrate value-based contract into the hospital contract with the idea of shared decision making and transparency between payers and providers. So let me go to the challenges. Why has there been low adoption of value-based care in the healthcare industry? Everybody wants it, but nobody knows how to achieve it. Well, one of the obvious reasons is the healthcare data itself, especially when it comes to claim. There isn't a standard, and for value-based care to be effective, the coordination of care throughout the continuum of care is needed. And you have to be interoperable with many healthcare systems that has your information about your patient in order to be able to evaluate the total picture. The other aspect, difficulty in value-based care is not one model fits all. You have to take into consideration your demographic variations, your different rules and policies that you have to include in your cost model. So the other challenge is those value-based care models are proprietary, and you have to license them from a third-party organization. They are very expensive, and they're not transparent, and they just give you a version of the model that you have to live with. If you want to customize it, it's at an additional cost. I know that from experience. Finally, having to evaluate the cost, the outcome, looking at the risk for the patient, looking at the efficiencies of the providers. Most often, most analysts do this in separate tools. It's not one tool that allows them to give them all these answers and allows them to connect those dots so you're able to look at the total picture of your value-based care. So what does SansHealth offer to help you? Well, the good thing is we have the value-based care analytics. Before we start going into the product itself, I'd like to basically give you an overview of SansHealth. I don't know if you have seen the demos earlier. If you want to get more familiar with it, please stop by the demo booth. It's right around the corner. We'll be happy to answer all questions. So in a nutshell, it's an interoperability-driven data management and AI platform to support healthcare analytic use cases and deliver business value across the continuum of care. It sits on top of VIA. When you order SansHealth, you are getting SaaS VIA. So I just wanted to clarify this. This is totally integrated into that platform, and when you get one, you get both. So SansHealth is not just one thing. It's an end-to-end enterprise solution for healthcare integration and data management focused on healthcare analytics. Ultimately, that's where the value is being able to deliver healthcare analytic in an easy-to-approach, standardized platform, giving you the single version of truth across all the pieces of your analytics workflow. So we start with the SansHealth Common Data Model. The SansHealth data model allows you to store both your patient claims as well as your patient electronic health record from the EMR. We have data ingestion tools that supports the FHIR interoperability, and we allow you to ingest data pretty much from any data source built on additional capability we built within our SansHealth framework, but also it relies on all the VIA, all the SaaS data management capabilities are available to you in conjunction with all of that. We store our data model in optimized, highly efficient databases. I believe we have launched, SAS has launched the SAS PD Store. That's a highly optimized database geared for large healthcare data, as we all know. This is one of the basic needs for healthcare is management of large data. The other databases that we support are Snowflake and Postgres. One of the most exciting features that my team is building and plans to release in Q3 of this year is the SAS Viya Copilot for clinical data discovery. So I have to read it because we just renamed the product. This is an LLM to SQL generator where you're able to identify cohort of patients based on complex temporal relationship between the events. I hope you saw the demo earlier. We are repeating that again in the demo booth, so please stop by and we'll give you an in-depth demo of that product. What I want to highlight about the use of the Gen AI and the LLM models, we never load patient data into the model. All we do is have the model generate the SQL for us. We take that SQL and we give you the ability to execute it, either save it, we show you the SQL, you can execute it on your own, copying it and pointing to your data source, or we execute it against our own data model and we present the results. So I want to make that very clear because patient privacy and securing patient healthcare data is one of our main foundations for building the whole entire platform. The other thing I want to highlight, I'm going to skip the SAS cost of care analytic because this is the topic of our presentation today. But I want to highlight that we have integrated out of the box some of the healthcare analytical models that are available in the SAS platform. I don't know if you've, I think we call them AIMS. There's a demo booth over there. Our first model that we plan to integrate is the medication adherence. There are additional ones that are in the pipeline, and as they come along, we will be integrating with them. The other thing I want to highlight is you could use the SAS Model Manager, the Intelligent Decisioning, SAS Studio as an extension of SAS Health. Our user interface allows you to have quick access to these models, and especially if you're using the common data model for your analysis, that gives you a really easy workflow where you're able to go from ingesting the data into our common data model to running analytics and within minutes, if not hours, if not minutes. So without further ado, let's go ahead and start diving into the value-based care. So someone asked me earlier this week, what do you mean by value-based care cost model? So I thought it's important for me to demystify what those models are. In simple terms, they are a template. They're just a document-centric template that defines certain aspect of your model. The most important one is your trigger. How do you trigger a condition? How do you define that somebody, obvious it's your diagnosis code, but sometimes it's not just that diagnosis code. You need the procedure as triggers your episode evaluation, because when that trigger happens, that's when you start counting the cost, is based on when the trigger happened. The covered services is your typical cost. And that's simple for many payer organization, because if you go to the doctor and the doctor has to go check with your insurance company to see if the service is covered. So payer organization has this information. Is there covered services? Is the treatment for that condition? Outcomes, quality and outcome. I think in the industry we all know HEDIS. It's your HEDIS definition for adverse outcome. Internal bleeding could happen anytime, but if it's after a surgery, it's a complication and bad outcome from a surgery. Sepsis, hospital-acquired infections. These are all common bad outcome for hospitalization. And your HEDIS definition is exactly what you can feed in here to identify that outcome. Hopefully, I'm getting to the point, this is not hard to do. This is, if you are either a provider organization or you are a payer organization, you should be able to come up with this information on your own. There are a lot of if you use one of those LLM models, this information you can gather yourself. So that very accessible. Provider attribution, this is another feature that we do where we identify the cost and identify the outcome. We assign that cost to a responsible provider. There are many ways that you can, what we define as a provider could be your primary care physician, could be your specialist, could be the organization in total. So there's a lot of flexibility in the model to be able to do that. Of course, risk adjustment, that's a portion of every patient evaluation. You have to look at their well-being and their comorbid factors and the severity of their disease when you're making this. The cost assignment is another thing. You often have patients who have 2 episodes of care, 2 independent. How do you attribute the cost? So these are some of the things that go into a cost model. So what we offer in SaskHealth Cost of Care Analytics is an episodic engine that can handle many of the industry standard cost model. Some of you are familiar with the Prometheus. The Prometheus is a very comprehensive costing model. And some of you who work with Medicaid and Medicare are aware of the CMS models. I think the one comes to mind is the BPCI. This is a very common model that gets implemented at the CJR, which stands for Comprehensive Care for Joint Replacement. This is the CJR, and the Medicare Bundle Payment for Care Improvement, which is the BPCI. So what we allow our customers and users to do, you can load the industry model. We have a template where you can upload your own definition. You can create your own. I've created my own models, just knowing what I need to capture. And I'm rushing through this because I have like an hour worth of stuff that I'm trying to cover in 2 minutes. So the main pieces of our engine is the episode construction. The episode construction is the heavy lifting. This is where we're bucketing the cost per condition per patient. The other pieces is filter and association. We allow you to filter out cost outliers, and sometimes if your episode definition, is for covers patients that are underage, you might want to exclude them from evaluation if you only care about your adult population. Other things, provider attribution. This is where we take each episode, each patient, and we look at the providers who tended the care, and we allow you to help us decide how to attribute that cost to the provider. Risk adjustment. This is industry standard, Elixhauser, Charlson. You can use that when you're trying to calculate the cost, and we have some budget models where we show you the difference in cost based on the patient condition versus a healthy patient who doesn't have a lot of comorbid factors. So one of the most, I believe, most valuable features in our offering is the analytical data mart that we produce after each step of the process. What it gives you is the ability to link the cost to the patient on a patient basis, as well as the provider. So we give you 3 perspectives. You can link the data on all of these 3 perspectives based on the condition, based on the patient, and based on the provider. And links to the claims are maintained throughout that data mart. So if you have to go and dig down to why certain patient was treated differently than others, you can get back to the source of the data. This gives you transparency, not only knowing how we evaluated your cost, but you can trace it back to the source. This is an example of some of the out-of-the-box reports that we provide. This gives you a patient insight. If you click on the list of the patient based on the cost, you're able to drill down and identify all the episodes of care that they had within the study period. Another example is, this is our per member per month calculation. We calculate that for payer organizations because that's important to know the average cost across their covered population. So we do that out of the box for you. You don't have to write a single line of code to get this. Again, if you click on the detail, we show you all the providers that went into, this is the colonoscopy, I believe. Show you all the provider. You can see how, what cost each provider, incurred for this particular condition. Last but not least, we give you the episode summary. You're able to have you can look at a summary per condition. You can drill down to the patient from the patient overview. And then, of course, averages is what all payers look. What is the average cost for condition? So now I'm going to jump into a demo. This is a pre-recorded demo. So I'm going to describe what I'm trying to do as it's going by very, very quickly. Stop by the booth. I'll give you in-person live demo. So what I tried to do is demonstrate the concept that our engine is able to evaluate many different models. So I ran the Prometheus model. I also ran the BPCI model, and I'm contrasting the result between. It's all about the model and how you want to evaluate the data. So let's go ahead and start. Here I'm logging on to SAS Health. From SAS Health, I'm going to jump into the cost of care analytics. First thing I'm going to do is create a data extract out of my database. So I am doing a comparative. I'm going to name it Innovate, what do I call it? Compare DS. This is my comparison data source. So I'm using the same data to evaluate two different models. And I think that's, this is so easy to do in our application. So once I've extracted, I get a profile of my extraction. The important thing is to know that I have patient, that I have coverage, and also that I have captured the claim. Because remember, our data model has both claims and encounters. So I want to capture the claim portion of the patient records. So once I create my, my data source, I create an extraction. There was no code. This is all run through the user interface. I'm creating a repository. A repository is a container where you can store your analysis. You need a place to, as you're doing processing and looking what-if analysis, you need a place to put all this information. So quickly, I've created, this is using the BPCI, not the Prometheus model, the HCI3 Prometheus model. As soon as my episode construction is done, I have an immediate dashboard tells you the result of the episode construction. I'm telling you per condition how many episodes we found and how many patients were associated with those episodes. Easy, right? So the next thing is filtering and association. I'm going to run all my analysis since I was happy with the amount of the episode construction result. And for each one of these steps, all these processes, you can apply customization. I mentioned filtering and association I can change some of the numbers. For the provider attribution, I think I have one condition that I want to change who I attribute the cost to. Easy enough. Primary care physician is what I think that's what I chose. I can't see from here. And then from risk adjustment, this is where you could choose which risk models you want to associate. I'm going to use the Charlson. There's also the condition specific. This is the one where you capture the severity of the condition itself. And then I'm going to run my budget model, and voila, that was it. A couple clicks away, I have completed a full cycle of value-based care analytic, all done with no code, low code. We've done all the heavy lifting for you. So that's, I believe that's amazing for, how much it takes for people to do this manually. Once my data is ready, I am ready. I'm examining, this is the analytical data mart that I talked about. There's a slew of output data that you could use for further analytics. If you wanted to build predictive models, this is the data that you could use to build your predictive model. So we're still going through the outputs. I'm looking at some of the numbers that are coming that was reported, and then I'm ready to take my data, and now I want to create my dashboard and my reports. So we write this data back to the common data model. Why? Because you want to use that same data to do your own reporting or you do your own analysis. So you have those outputs available to you, so you're able to do your own thing with them. We don't assume we know what you're looking for, so you're able to do that. I think these were in my slide. I cut this video earlier because I know we're pressed for time. I'm just showing how you can interact with those reports. This is the one for the Prometheus model. You could see there's a PAC cost, which is your negative outcome. It's the potentially avoidable complication, and you can drill to the patient level. Just super easy way to report on the data and get insights. This is where you can drill down to the patient level. And then, of course, this is the same view, but gives you averages versus totals. And I think when this one goes, I'm going to go back to my interface, in SAS Health, and I'm going to compare it with the previously ran CMS model. Right off the bat, you notice I have different model because I only have acute and procedural, and I have 24 episodes for each. I look at the data. If you contrast the outputs that you come, it is the same report, but it's adaptive to the data that was produced. I only have the two conditions, and if you look at the zero, that flat line is that model did not calculate negative outcome. But you still get the same averages and that. So that ends that very brief demo. If you want to see all the other reports, please stop by. I repeat this demo, I think at 3 p.m. I'll probably try to do it live at this point, but going back to SAS Health, with that, I thank you for attending this presentation. I hope we have time for Q&A. I'll be happy to answer here or over there. What I want you to go away from this presentation is how easy it is to do this difficult task at SAS Health. And the key for value-based analytics, you cannot just do one piece of it. You have to do all of them together, and you need to be able to connect those dots together. So thank you very much.